Hello, welcome to the Faculty of Dental Sciences, University of Sri Jayawardhanapura. You are linked to the Restorative Department at the University of Sri Jayawardhanapura. Today we are talking about different treatment when a pulp of a tooth is exposed. You know, tooth is composed of different structures. The outermost layer is enamel, underneath which you will see the dentine, and dentine is yellow in color, and you see some lines over there which denotes that it is having some sort of tubes, very minute tubes communicating from the center of the tooth, that is where you get the nerves, and that goes right up to the enamel. But different to that, enamel I showed you, the outer structure does not contain any communication with inside. So enamel is protecting your teeth. Here you can see you have two sets of teeth. First, the milk teeth set that contains 20 teeth. When you achieve the adulthood, you get 32 teeth, where top 16 and bottom 16 are meeting each other. All these teeth are having roots which is holding the crown in position. And these roots are held inside the bone, which we call as alveolar bone. But from one to another, the root shape and the number of roots are different, as you see in this diagram. Especially the front teeth have a single root, whereas when it comes to the premolar region you get two roots, and in the molar roots region you get three roots. Sometimes it may even be more than that. So this is the cross section. You see the whole tooth held there, and most importantly you can see the nerve supply, blood supply, everything to the center of the tooth, which you call as the dental pulp, is coming from the bone itself. So that is very important to maintain the integrity of the tooth. And enamel is having no communication between these nerves and blood vessels. So in an intact tooth, you don't get any sensitivity or pain. The enamel you saw, but inner parts are not that. It is porous and it can be communicating through the pulp, especially in young age. Young teeth are very strong, unaffected teeth are very strong, so that you have to protect it, and there is no communication to the inner part which contains nerves, so that you don't get any sensitivity or pain. You can see inside these tubules, which I described at the beginning, you have some cell compartment going into that. These are also capable of conducting some nerve impulses. Here you see the three-dimensional view of a tooth, and inside what is rotating here is the nerve compartment, which contains nerves and blood vessels. As you see, the cavity is extending from the surface of the enamel. At the beginning you may not feel anything, but once it goes into the dentine you will get some sort of sensitivity, as if when you are taking cool water you get a feeling of sensitivity, and then once it extends right deep into the area where you have nerves and blood vessels, it induces a severe pain. So it is all important to preserve these nerves and blood vessels throughout your life without being damaged, and for that purpose you have to brush and maintain your teeth really well. As you know, there are certain other reasons, for example breakage of teeth, that is fractures, and wearing of teeth will also lead to loss of the superficial strong part of the tooth, what we call as the enamel. And once it is gone, you get sensitivity. If it further goes in, you will get the pain. I am highlighting this again. If you have a very minute effect on the pulp, for example, if it is a traumatic injury to the pulp tissue, you can see just the superficial part of the pulp which is not infected. In such instances, one can do a pulp capping and fill the tooth. But in extensive cases where the cavity extends deep and infection goes into the deeper structures of the pulp will die, as you see. In such instances, we can't preserve the remaining pulp, as I told you at the previous occasion, where the infection is minimal. You can do pulp capping. Here you won't be doing pulp capping since the pulp is all dead. In such instances, we will have to make up a bigger access cavity so that you have direct access to the nerve canals, which has to be cleaned properly, then irrigated well. After irrigation and control of infection, we dry the canals, ultimately fill it, or we call it obturation. We nicely seal inside the canals with a material called gutta percha, and this is root canal treatment. This treatment takes fairly long time and it is happening free of pain. If the nerves are vital, we will have to give injections and do the root canal treatment.